No. Is 3 enough for you?
Yeah.
Testing. All right, how's everybody doing? You guys ready to get started?
Yes.
All right. Actually, let me see. Can you hear me okay if I don't use this? Yeah. If people come and fill in the back, I'll use this, but. All right, so I'm Italian, so I'm gonna be moving around a little bit. Then I'll sit up there and put it to the side. Yeah, half the time.
Just want to say hello, everybody. Isabella second kid tonight. Okay.
Thank you. All right, yes, so I recognize some of your faces, and then some people are new. And actually just show of hands, who's new, who didn't come last time. So you guys. Okay, so actually more people knew. But I remember him, and I remember a handful of you. So I'm Isabella. Dr. Al is ironically sick, so he's not here. He actually never gets sick. He has acute bronchitis right now, and he just sounds terrible. He was going to come in and just sit up there, but we figured it probably makes more sense for him to just stay home and rest. So I am here to take over. We'll see how it goes. It's going to be a little shorter than planned, just because he's not here to do his slides, but we'll see how it goes. So this is Forever Young, the winter edition. And yeah, I wanted to start with these birds. I added these in today. So how many of you guys went outside this morning and realized how much nicer it was and warm and heard the birds? Anybody? Yeah. I stepped out and I was in a rush and I stopped and I was like, oh yeah, okay, there it is. That's what I've been waiting for months. So it made me realize how much I've been on the run the last couple weeks, and so I thought we could start this with just 2 deep breaths all together to like calm down as we enter into the presentation. Sound good? All right, so I'm gonna do inhale for 4, exhale for 6. If you're not comfortable inhaling or exhaling for that long, you can do shorter breaths. But I'll just count with you guys, and we're gonna go in the nose and out the mouth. So if you wanna shut your eyes too, you can do that, but I'll walk you through it. So all together, we can inhale. 4, let it out. And one more time, we're gonna inhale. And exhale really long. Hold it out. All right, a little more centered. And by the way, if you don't already know, when you exhale longer than you inhale, you activate your sympathetic nervous system, which is your rest and digest, rest and restore. And that's where healing happens and where your brain calms down. And actually, I'm gonna use this because I feel my voice getting a little crackly. So let me sit up here for a little bit. I'll get up and move around again. I can't sit still for too long. But yeah, so what can I expect, baby, being you? What can you expect from this series? So this is a 3-part thing. We were here last year and we just talked about functional medicine in general. This is a little bit specific to winter, which is going to be the next 2 sessions. But basically to increase your health knowledge, hopefully, give you some practical tips on immunity and anti-aging and staying forever young. And then hopefully we inspire you, I guess tonight just me, and it's supposed to be a little bit fun. We'll see if that happens, but yeah. Oh, and then I have the disclaimer. So I always like to say when I'm health coaching someone, any talk, anytime, interviews, podcast, this is not medical advice. This is for educational and informational purposes only. I'm not a medical doctor, so yes. And even if I was talking, it's never medical advice. And anything you hear in this podcast, behavior changes, lifestyle, nutrition, diet changes, always, I'm legal to say, always check with your physician before you make any changes. Okay, so who is Dr. Al? So I think I have a picture I edited in. Yes, there he is. So infamous Dr. Al. So Dr. Al has been in functional medicine for over 35 years. Father Ron and him are pretty good friends. And I met him 2 years ago now, but he's an awesome guy. He's right down the road in Wakefield, and he's been helping patients. I don't know what else he was going to say about himself. I guess he used to own a music studio many years ago, but he got into this field because his family got really sick. So let me try to do my notes here. But basically, I believe it was 1989, his mother and father, pretty close together, fell ill. I think his mother had cancer. And then his sister, his older sister, I think she got Parkinson's, and like in a rapid span of a few years, multiple people in his family just fell off. And I can't remember, he'll have to tell you next week when he's here, but something tipped him off to diet as being a thing that helps your health. which was not a thing talked about back then. I wouldn't know, I wasn't there, but so I have heard. Yeah, and so he looked into it, and then he was very overweight at the time. In the span of a year, he lost 70 pounds and totally turned his health markers around. And since then, he'll tell you, obsessed with this stuff. He's obsessed with research. I tell him to go home and relax, and he insists on reading and looking up YouTube videos about this stuff and not watching movies. So he's awesome. Hopefully you guys can be here next week to be with him. He's incredible to listen to talk. But yeah, basically this slide was just to show that he had the standard American diet all growing up. His family did. Large reason why they all got sick. And he switched it to the Mediterranean diet, and weight fell off. He didn't do any strenuous exercise. So, pretty good story. Ties into everything we want to teach you. And then this I had last time too, but this is just his TikTok and his best video to date on colon cancer prevention. Okay, and who am I? So I'm Isabella. I have Master's in Nutrition Science, which is a combined Master's in that and Agricultural Science. I'm a certified health coach, I'm a Zumba instructor, I guess those are my credential things. But I have sad news, so I'm a little off today. I was just telling Carol, and I had told Karen, my grandfather did pass away yesterday, so a little rough right now, don't want to get choked up. But I still wanted to come here to give this presentation for you guys. So I took some notes today. Yes, okay. So this is what I want to tell you. So I want to tell you that so you know that I'm not my normal, like, silly self, and I don't have as much life in me. If I was an iPhone, I think I'm at like 10% right now. So bear with me. I promise hopefully next week I'll be a little bit more fun to be with. But I wanted to come here to teach you guys because I'm very passionate about this stuff. And has anyone ever heard of Dr. Zach Bush, who's an MD in this field? Yes, that surprised me. But so he's phenomenal. He talks about all the stuff that we do, and he has this lecture on death. And so I took notes on it like a month ago, and then I just pulled from them to share with you guys because I thought this was relevant, and then my no-no reminded me of this. So Dr. Zach Bush says, "What is the highest joy you have today, and what is the future you would like to see tomorrow? Who are the people you would want at your bedside? What conversations would you like to have? What gifts would you like to pass on, and why are you waiting until then to pass those gifts and those words on? Let us see the fruits of our gifts today. We signed up for this journey here on earth. What will we give to the humans around us? What are the most important things we learned in our lifetime? We shall communicate with each other with the reverence of the moment." So I just thought those words were powerful, and they describe why I'm here with you in general with this presentation, but also why I decided to show up tonight. So hopefully I can get through the next half hour or so, but yeah, so that's me. Oh, and before I go into that, also, I have had a lot of thoughts today, but I was thinking, I usually go give talks, and I just dive right into the science and the nutrition and things, and I was like, I never talk about anything about myself, and I don't know if anyone wants to know anything, but maybe that will help you give some context, right? So I was like, okay, I should tell these people a little bit about me, because they're probably wondering who this girl is. So I'm 28 years old, I'm from Albany, New York, Saratoga, if anyone knows, does anyone know what that? Yep, some nods, okay. I came out here in 2020, not a great year, but I came out here for grad school at Tufts, and then everything blew up, so that was pretty interesting. I've been working since 14. Let's see, I've worked most of my life, weekends, and let me see this. One sec. What else did I want to tell you guys? Let's see, I've danced my whole life, I did rugby in high school, I did jiu-jitsu. I've already mentioned that I'm half Italian, I'm a quarter Indian, and I'm a quarter Irish, even though I don't look Irish. And I'm an oldest sister, and I wanted to say that because I think that provides context to my personality. I don't know if there's anybody in the room who's an oldest sibling, but yeah, we're a little hard to be around. And then I just wanted to say I've been through quite a few trials and tribulations in my life, which I won't talk about at this talk, but which shows you why I'm here and able to do this despite my heart hurting at the moment. But and the last thing, which I was nervous to say, but I did write this down. I'm skeptical of the world around me. I overanalyze everything, always have. I question everything, whether that's political, science, literally everything. And so I've considered both sides of every coin when it comes to most issues, and that's how I make decisions, but I'm very open-minded. That being said, that's clearly led me to functional medicine, right? But when you're like that, maybe some of you can relate, you tend to be a little bit more pessimistic, especially now with everything, right, in the current climate. But I will say that I'm thankful for Dr. Al, Father Ron and Karen, because they're all good people that like show me, oh, there are good people. Not everything is crapola, even though it seems it on the news. So that is what I want to say. But so let's get into the science and why you guys are here. So, actually, I'm gonna get up with these. So for some of you who were here last time, I told my story in more depth. I'm not gonna do the whole thing right now. One, I don't want to bore you guys, but two, I have more things, but I'm gonna tell a little bit about it with some extra details for those who heard it before. So this, everything you see up here right now, I don't know, can you guys see on the left like the words on that one? Not really? Yes, no, no? Okay, so I'm just gonna read through some of them. So hair loss, anxiety, depression, belly fat, pain in pelvis area, ovarian cysts, irregular menstrual cycle, waking, dark spots, skin tags, insomnia, acne, depression, and then this one, I'll just call out a few of the bigger ones. Let's see, cramps, constipation, diarrhea, I know, gas, bloating, food allergies, food sensitivities, inflammation, aching joints, blah, 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 fatigue, anxiety, candida, IBS, headaches, memory loss, all these things. So this isn't even all the symptoms that I had that I was going through. But this is a pretty good list, pretty good diagrams. And basically I started falling apart in 2017, and each year it just got worse and worse. Let's see. What did I want to tell you guys today? Right, so that embarrassing photo that my sister's like, ew, why would you put that ever in a presentation? But, so that's me in the ER at the worst of it. Has anyone ever had anaphylaxis or someone in their family has had it? Yes, so life-threatening allergic reaction for those who don't know. When you go field trips to school, it's the whole kid with peanut allergy can't bring peanuts, it's because of anaphylaxis. So real quick side note, a true allergy, maybe people have them in the room, that's people who carry around EpiPens. It's an IgE antibody response, okay? It's not the same thing as a food sensitivity, which is an IgE, I think, food sensitivity response, but if you have leaky gut syndrome and your sensitivities are building and you have chronic inflammation, you can have anaphylactic-like reactions. This is all new information for the medical field and for science. It's not fully understood. That is what my functional medicine doctors believe happened to me. It's what I believe happened to me. Very scary time. For the longest time, couldn't have dairy, gluten, eggs, peanut butter, fish, because it was getting worse and worse reactions. And then this was the one that I literally got rushed in the ER, almost died, saved my life. Yada yada, crazy time. But no, so that happened to me, and I put this here to show how bad it got for me. There's a lot that went into this story, but everything in red is conventional medicine physicians or specialists. So I'm going to talk to you about conventional versus functional medicine briefly. But these people were unable to help me as my symptoms progressed and got worse, and as I was going through things. They had never seen anything like these food sensitivities. They kept having me get allergy tests. They didn't know what was wrong. You know, when they would see something on the panel, they'd be like, oh, go to the endocrinologist, and she didn't know what to do, and no one realized it was in the gut, was related to the endocrine system, was related to the liver, etc., etc. So, what caused all of this? So no cheating if you were here last time. I'm looking at you. So I just wanted to ask real quick, anyone have like, what are the main contributors you think that led to something like that? Don't be afraid to be wrong. No idea? Food, diet. Anything else? Stress. Sleep, lack of sleep. Genetics, maybe. So, those are all big ones.
SIBO.
What did you say?
No,
Oh, SIBO, yeah. So, the main thing, again, this is according to my functional medicine doctors and to myself with all my research, is leaky gut syndrome. So Dr. Al always talks about a cheesecloth, if you've never heard of this, and basically, you know how there's like little holes in it? So you have tight junctions in your gut along the intestinal lining, you have epithelial cells. We all have a semi-permeable gut, semi-permeable intestine. When you have leaky gut, the junctions are a little looser than they're supposed to be. This happens from a lot of things. Poor diet is one of them. Stress is a huge component. Functional medicine practitioners, holistic health, have been talking about leaky gut for over 20 years. Dr. Mark Hyman, Dr. Zach Bush, Dr. Al, a couple other big names, Dr. Axe, he's a whole big guy on YouTube. But modern medicine, conventional doctors, they have only been starting to talk about this in the last couple of years. To give you an example, I was on harvardhealth.com the other day, and their medical newsletter, I don't know if anyone subscribes to it, but they just posted last year, 2023, about like leaky gut, what we know, blah, blah, blah. And so there's only a few studies, but we have limited knowledge about it. Basically, like I said, the junctions in the intestine are letting things through that shouldn't be. Toxins and undigested food particles. So, what did I want to tell you guys here? This is where I needed Al to jump in. So if you don't know, 80% of the immune system does reside in the gut, which is not common knowledge. And your microbiome, in case anyone doesn't know what that is, that's all the little bugs, which are good things and some bad, that live in your intestinal GI tract from your mouth, out the other side. And basically if you have an unbalanced microbiome, unbalanced community of bugs, and you have leaky gut, which are two things, you could have either or, both, likely both, you are susceptible to everything. There's a book, I didn't bring it with me, Antiviral Gut, that just came out last year by Dr. Robin Chutkin, MD. She has all the studies on people with COVID who were hospitalized and who died. For the people whose microbiomes they could study were all very similar and lacking like beneficial certain bacteria, which is pretty crazy. Same thing with colon cancer, they see very similar microbiome panels. And yeah, your gut impacts everything in your health. Again, 80% of the immune system. So if your bugs are out of whack, your immune system is dysregulated. And I want to say it's 90% of serotonin is produced in the gut. So if your gut's out of whack, you have leaky gut, you're not going to be producing the feel-good chemicals, depression, anxiety, which we talked a lot about last year.